And we are live. Hello and welcome. We are so pleased to have you joining us today for our third annual How Lupus Affects African American and BIPOC Communities virtual symposium, presented by More Than Lupus in collaboration with Looms for Lupus and sponsored by GSK and Black Health Matters. This is our first installment in the Lupus in Minorities Health Series in sponsorship with GSK, and we are so thankful for their support. Now, for those that are watching this live or who will be streaming this later, we hope that this is an informative time and also a time where we continue our plan of action to address past and present disparities, work to educate and eradicate misinformation about BIPOC, and have an open discussion on how we must remove barriers to care. Our hope is through highlighting the work that is being done and coming alongside organizations and individuals that offer community-based solutions and resources, we can look towards improving the future of African American and BIPOC individuals living with lupus. Now, unfortunately, a staggering 2/3 of Americans know little or nothing about lupus, a disease that disproportionately affects women, and in particular, women of color. Recent research indicates that 1 in 250 African American women will develop lupus. And lupus is more common, it occurs at a younger age, and is more severe in African Americans. Also, a recent study found that African American men are more likely than white men to have kidney, lung, and heart damage, which can result in earlier mortality. Why is this? It's not fully known why lupus is more common and often more severe in African Americans. But we are going to talk about some of these challenges and the need to address these disparities today. And let's start now. Please welcome our moderator today, Miss Anita Noble-Love. She is producer, philanthropist, board of directors member at More Than Lupus. She's a lupus advocate, a lupus survivor, a lupus thriver, and she is my dear friend. Welcome, Miss Anita.
Oh, thank you, Kelly. I feel like blushing after that introduction. My goodness. So you said it all. I'm a 68-year-old lupus survivor. I've had lupus about 21 years. I was diagnosed by a dermatologist back in Indianapolis. I'm also a mother, a wife, and a grandmother of 10 children. My lupus involvement are my lungs. So in my doctors, I have my rheumatologist and my pulmonologist. And as Kelly said, it affects, African American women more. I have lupus on my maternal side of my family and my paternal side. So I believe genetically lupus runs in my family. So I'm just honored to, introduce you speakers. You will each introduce yourselves and briefly share your background, and we shall start with Ebony Scott. Welcome, Ebony.
Thank you, Anita. And I want to thank Kelly and the organizers today for allowing me to participate in this much needed and timely discussion. I think it is important to have forums like this that we're able to discuss lupus and its detrimental impacts to the community at large, and not hosting these conversations behind closed doors, but allowing the community at whole to participate. So I'm going to begin with showing my presentation. Go to the next slide. Okay. So as I shared, my name is Ebony Scott, and I'm Director of Health Equity at Lupus Therapeutics. I have over 13 years of research experience. Most of my research began in academic medical centers, but I have transferred to the nonprofit space. And I'm going to show a brief video about what is Lupus Therapeutics.
So Lupus Therapeutics serves as the organization that oversees the clinical trial development program.
Are you able, I'm just making sure you're able to see the right screen? No. Technology, sorry about
It was
that.
playing for a hot second.
Okay, now we go.
So Lupus Therapeutics serves as the organization that oversees the clinical trial development program of the Lupus Research Alliance and coordinates and manages the activities of the Lupus Clinical Investigators Network, which is the vehicle that's responsible for the trials. Every day is a new day, and every day we break through a new barrier. And we'll keep doing that until we're successful, and the people that we serve feel like we've made great headway.
Okay. So that was just a brief overview of Lupus Therapeutics. As you saw, we're introduced to our executive director, Albert Roy. And so what Lupus Therapeutics, really what we are the bridge between pharmaceutical companies, the biotech space, clinical trials the sites where we are conducted our clinical trials at, as well as the persons with lupus. And we really are bridging all of these people or all of these partners together to make sure that we are creating and implementing lupus clinical trials in a safe and effective way. And we are including those who need to be concluded and evaluated in these lupus clinical trials. And so I will share a common thread in all of my background is that I have worked with teams really to understand or eradicate health disparities. And health disparities are the differences in the prevalence and incidences of health conditions that disproportionately affect populations, unfortunately, due to social, economic, and or environmental disadvantages. And we know that these inequities that drive health disparities, the root causes of these are racism and discrimination that have seeped into the 6 core components necessary for a population or people to achieve optimal health and well-being. And these include economic stability, neighborhood and the physical environment in which we live in, access to education, access to food, healthy and safe food, living in a community that is safe and with a social context, and then access to healthcare overall. Some of these health disparities that we are maybe aware of or have heard of before include hypertension, hyperlipidemia, which is also known as high cholesterol, obesity, when we start to look at cancer mortality and prevalence rates, as well as lupus mortality and prevalence rates. And so who are the groups that are most impacted by these health disparities? We know that populations that systemically and traditionally experience greater obstacles, unfortunately, are more susceptible to health disparities. And the NIH, or the National Institute of Health, has designated 9 health disparity groups to include American Indians, Alaskan Natives, Asian Americans, Black or African Americans, Hispanic Latinos, Native Hawaiians and other Pacific Islanders, sexual and gender minorities, socioeconomically disadvantaged population, and underserved rural populations. I will share that unfortunately, the majority of our lupus patients make up these groups, and these groups are not siloed, and that you can be a member of multiple groups. And so we can see how being a member of these groups, unfortunately, can lead to the development and the progression of health disparities, including lupus. So I want to take a step back because I realize that many of us who are on this forum today may not know the impacts of lupus. This may be the first time you're introduced to lupus. This may be the first time you're logging on to More Than Lupus and you're new to the conversation. So I think whenever we have a conversation like this, when we are discussing lupus, it's important to really take it a step back and talk about the basics of lupus because it is a very complex and unknown disease. Okay. And you may recognize the moderator of this next video.
As the largest nonprofit in lupus research, the Lupus Research Alliance appreciates that the organizers of this event are bringing to light healthcare issues that impact the Black community. Education is emancipation. It means light and liberty, as Frederick Douglass once famously stated. We are here to increase awareness of lupus, a complex autoimmune disease which disproportionately affects Black women. We must achieve equality in healthcare for all, and one way is being at events like this to make sure people know what lupus is, so they can spot its symptoms and consult their doctors. Lupus is a serious autoimmune disease in which your immune system attacks healthy cells by mistake. I'm a member of the Lupus Research Alliance Board of Directors, a broadcast journalist, and most importantly, the mom of Kelly, who was diagnosed with lupus as a teenager. I joined the Lupus Research Alliance because funding science is the best investment I can make to ensure a better future for Kelly and the millions living with lupus around the world. The Lupus Research Alliance is dedicated to advancing every aspect of innovation, from breakthrough research in the lab to testing new treatments in the clinic. Lupus is often called the disease of 1,000 faces because it affects people differently and can change over time. That's why research is so critical to finding personalized treatments. The best way to understand lupus is to hear from the people affected by the condition, leaders in the community, and the healthcare professionals who devote every day to improving their care.
Okay, perfect. So Brenda Blackman, who is a board member at Lupus Research Alliance, she did a great job of highlighting the key factors in a quick way and succinct way with lupus, but I think it's really important to reiterate some of them and tack on some more. So approximately lupus affects 5 million people around the world, where 60,000 people in the United States each and every year are diagnosed. 90% of all persons with lupus are women, and women of color are 2 to 3 times more likely to develop lupus. We see the highest prevalence rates among African American and Black women and while there are other racial and ethnic groups that lupus does affect, we see prevalence rates the highest in this community for a variety of reasons. Most lupus persons or persons with lupus develop between the ages of 15 to 44. And once again, we see African American or Black and Hispanic women develop lupus at younger ages. And on average, they suffer from more severity of symptoms. Annually, we see costs of around $6,000 to $10,000 to treat persons with lupus. Beginning in the 1990s, researchers really wanted to unpack were there factors, specifically genetic factors, linked to the disease progression in lupus. Because as Brenda shared in the video previously, lupus is a complex disease and extremely critical in that it can attack multiple vital organs throughout one's body. And so researchers started what was known as the Lumina, or Lupus in Minorities, Nature versus Nurture cohort studies, really wanted to unpack were there specific genetic factors linked to disease progression in lupus. And it was found that those who had genetic ancestry linked to African, Asian, and Hispanic Americans were linked to increased disease progression. Additionally, it was found that social determinants of health, specifically those who lived in poverty or beneath the poverty level, were more susceptible to disease progression. So let's take a step back. I just shared that on average, people develop lupus at a younger age. Then we see that the annual costs are between $6,000 to $10,000 per year. So let's say a person with lupus, or you're diagnosed at the age of 18. By the age of 40, you would have they would have accumulated over $130,000 or more just in medical care alone. And we know that is not feasible. Unfortunately, many of our patients or many people in general don't have adequate health care to cover all the necessary costs, the screening labs, the tests, the medicines, everything needed to really treat lupus. And so that is the disparity right then and there. We really can see how, social determinants of health really impact the progression of lupus and the severity of it. And so taking it a step a little further, we look at the U.S. clinical trial participation by race. And so we're doing this because clinical trials are used to assess the efficacy of medicines, drugs, and treatments for all medical conditions. And we're going to talk about specifically about lupus in a little bit later. But I thought it was important to first provide a snapshot to show among all clinical trials in the United States, let's look at the breakdown. So we see 78% of participants identified as white. This is followed by 16% of all clinical trial participants identified as Black or African American, followed by 3% other and multiracial, 2% Asian, 1% American Indian or Alaskan Native. Now let's take it a step little further and look at the actual therapeutic areas by race. So once again, it is illuminated in which we see that clinical trial participation of white participants significantly outweigh the participation of other races. Looking in within pulmonology and rheumatology, in which lupus is a part of, mirrors what we've been seeing before, that clinical trial participation heavily was favored among white participants compared to other racial groups. And so the lupus space, we really applauded this past August when Safenello was approved by the FDA or the Food and Drug Administration to treat SLE. And so when we take a step back and see the actual trials, which were 3 clinical trials that were used to assess the efficacy of Safenello, we see the same history, and that the participants of other racial and ethnic makeups were the minority within the overall participants of these clinical trials. And so I will share that, Lupus Therapeutics and Lupus Research Alliance are really trying to intentionally address these inequities through many different initiatives and programs that I will share and talk about a little bit further. So in 2017, Lupus Research Alliance and the National Minority Quality Forum hosted a joint session in 2017 to discuss or address these barriers to clinical trial participation, because everyone started to recognize that this is a problem. Like, why is it that we recognize that the majority of our lupus patients represent these racial and ethnic makeup, but this is not what we're seeing in the actual clinical trials? And so wanted to understand, why are not more people joining these clinical trials? And what we saw were we found a host of different reasons why, but the key reasons or the key barriers to clinical trial participation included a lack of transparency regarding how clinical trials work and the benefits of participation, the lack of knowledge and awareness of trials. And I will say that is both on the practitioner side and the patient side as well, because we have spoken to a lot of community doctors who do not know what are clinical trials, because clinical trials are not being conducted at their sites. They're being conducted at academic medical institutions, where sometimes many of our lupus patients are not going to academic medical institutions to receive care. They're going to their community doctors. Also, there's a complex trial protocols, and there's complexities around recruitment methods. So we see sometimes with lupus clinical trials, when we're thinking about patients having to travel, sometimes we see that the trials are being conducted 4 or 5 hours away, that they have to, travel long distances. And that is not feasible when we're thinking about that lupus can affect every part of your body, on top of having to live a daily life, take care of families, go to work. So there's so many different factors that are associated with this. And sometimes, unfortunately, that is not taken into account when creating protocols. Also, we've heard from patients that there's a fear of receiving a placebo drug or being a part of a trial and then not being able to take a drug or a treatment because it will conflict with the actual clinical trial. As well as there's misperceptions, biases, and hidden beliefs by both investigators and potential participants. And I touched upon this a little bit earlier, but there's financial strains for the patients. So a loss of work time, think about if you have children, grandchildren, and you are the sole caregiver, who is going to take care of your child when you are traveling back and forth to the clinical sites where there are clinical trials that are not able to come to your house or provide transportation. And so Lupus Therapeutics and Lupus Research Alliance have collected all of these barriers and challenges. And really the last couple of years have been developing, a way to address these inequities in lupus research. And so we are here to talk about Project Change by LT, which is community-based health action network to generate trial participation and eliminate disparities. And this is the last video.
Let's listen to some of those people.
Project Change by LT is to increase participation and retention in lupus clinical trials among those populations that are most impacted, the most vulnerable people who are affected by lupus, which are people of color. We're hoping to address the unique situations and challenges that persist in these communities and really increase the educational pipeline between those who are most impacted in lupus clinical trials. It's extremely important for people of color to be participants in lupus clinical trials, given the fact that lupus affects people of color 2 to 3 times more than other counterparts, especially African-American women. They have the highest rates of lupus. However, we know that clinical trial participation among these groups, specifically African-Americans, is less than 14%. So if we have more participation among these groups, then we can really start to uncover the symptoms of the side effects, and we're more empowered in knowledge, and we can share that information onto patients, and there's less confusion around this. I have family members who have been directly impacted by lupus. I have family who have died from lupus, and I understand that there are so many different unknowns and uncertainties around in lupus. And just so we like all health disparities, they impact those people who are most vulnerable, people of color. And I feel like a duty and an obligation, because I look like the communities, I want to go back and really help and serve those communities and provide tools and resources that will, I won't say eradicate health disparities, but start to diminish them and really chip away at those things. Okay. So Project Change by LT is doing just that. This is a novel approach in which we are basing this project on community-based participatory research. And with community-based participatory research, it's important to see the patient not as a participant, but as a partner in the overall development of the research process, from the protocol design, from the development to the implementation. And so while there are many steps to Project Change by LT, we were able to capture it or highlight 3 main milestones. So the first milestone is that we are establishing a steering committee. And this steering committee will be our overarching brain, or really guide the efforts of the overall project. This steering committee will be co-chaired by a person with lupus. And so it's really important to have that voice in every aspect of the process, because we know that while we have the best intentions, some of us, we don't truly understand what it means to live with lupus, what it means to access healthcare, what it means to go to the doctors and talk to them about clinical trials, or be turned away from clinical trials for a variety of reasons. So it's important to have that insight and input from the very beginning. Lupus Therapeutics will fund and provide ongoing technical assistance throughout the entire way of Project Change. And lastly, we will evaluate the efficacy of Project Change with the hope that we can replicate this in communities and neighborhoods throughout the nation. I just want to take a moment to thank our current sponsors of Project Change by LT, which include GSK, Royalty Pharma, AstraZeneca, Bristol Myers Squibb, Janssen and Lilly. Also, just a quick resources. I'm sorry about that. That's so small. When we send out the presentation to everyone, so these are the email addresses, because I received a question as to where can you find out about clinical trials in your neighborhood. So it's lupustrials.org is the website where you're able to find clinical trials throughout the nation, as well as you can go to lupustherapeutics.org. I also had my email address if anyone wants to contact me directly. It is escott@lupusresearch.org. And I want to thank everyone. Thank you.
Thank you so much, Ebony. That was very enlightening and informative. And as a lupus patient, you're right. Having participation by someone who has lupus is critical. Now we will hear from our next speaker, who is Stephen Noble. Welcome, Stephen.
Thank you, Mom. So it's a pleasure to be here with everybody today. My name is Dr. Stephen Noble. I'm a board-certified cardiothoracic surgeon, which means I treat the #1 killers of Americans, heart disease and lung cancer. I also serve as lead medical advisor for Live Chair Health, a healthcare organization looking to address healthcare disparities by leveraging the trust that we have in the community with places that we have trust in safety, barbershops, churches, salons, things of that nature. I also had the pleasure of being the author of the children's book, The Heart of the Hero, the story of Dr. Danielle Williams, and serving as associate producer for the documentary Rise Up, Black Men in White Coats, which chronicles the disparity of healthcare professionals, in particular the fact that of all the physicians in America, only 2% are represented as Black men. With today being, or with this month being Heart Month, American Heart Month, it's very apropos that we talk about lupus and the heart. As Kelly, as well as Ebony eloquently stated, the association that we can see with lupus in various organs of the body. Lupus is an autoimmune disease, so it attacks your own body. And what we find is that lupus can have a predilection of really affecting the heart. So taking a step back to really underscoring heart disease. So heart disease is the #1 killer of Americans. It's the leading cause of death in the United States. 1 in 4 Americans will die due to heart disease every year. As it relates to African Americans, nearly half, so 50% of Black Americans will either die or develop heart disease at some point in their life. As Ebony appropriately stated, there is an association with heart disease and lupus. In particular, it can affect the kidneys and the heart, and about 90% of individuals that get lupus are women, and a quarter of lupus patients can develop what we call pericarditis. Pericarditis is inflammation of the sac around the heart. So the heart beats continuously, and it sits within a sac. And is that inflammation around pericarditis, and it can pain and can lead to a decrease in overall heart function. If that the heart is beating very inflamed.
Excuse me, Stephen?
Yes, ma'am.
You're breaking up, or something's going on. Yeah, right now that's static or breaking up.
Okay. Have inflammation around the heart.
Excuse me. Is anyone else hearing that? Yeah, we're all hearing it. You know, some of your words aren't coming through. I don't know if we need to adjust something. You started off fine, then all of a sudden you got stuck.
Yeah. So next,
Okay, so it looks like Stephen's going to work on his audio issue. Dr. Noble's going to work on his audio issue. We'll go to Alicia.
Welcome, Aliciee. We can't hear her.
Okay, I was talking but didn't realize I was off of mute. Okay, you can see my slides, correct?
Correct.
But it's not in, it's not showing as a PowerPoint?
It appears to be.
Is it
Your
full screen
icon
or
it's not full screen.
Yeah, let me go back here again and make sure I have it on. Okay, full screen. Just a moment. We will get this right. There we go. Let's see. Now it should be showing us full screen. Is that correct?
Yes.
Hello? Okay. All right. So we'll get started. Hello there. I am Aliciee Griffith with GlaxoSmithKline. I am a registered nurse for more than 30 years, and I have been working in GlaxoSmithKline's field, working with lupus for almost 7 years now. But as I said, I've been a nurse for over 30 years, so I've seen lupus and many other conditions during that time period. Today, I'm going to share with you some tips for better understanding where to start and what to ask when you have questions about your insurance coverage. So we'll talk about insurance and the burden that it can have. I just want to give recognition to the fact that lupus is a chronic disease and it's a lifelong illness that can cause a outsized financial burden and impact on you as a lupus warrior and also on your family. There are so many contributing facts to the cost of lupus. When we start with the first one, looking at medical appointments, as someone living with lupus experiences the flares and the normal day-to-day challenges of living with lupus, you know that you have healthcare appointments that you need to follow up on and on a regular basis, pretty much. The cost of those appointments may vary based on what type of appointment it is, whether you're seeing your physician. Also, your insurance coverage will have a bearing on the cost of that, along with the services that are being provided when you go see your healthcare provider and any tests that may be run. In addition to that, you may have some unexpected urgent care visits, and it's not uncommon if you're living with a chronic disease such as lupus for you to have to go to an urgent care outside of normal office hours or even make an emergency room visit. Visits to the emergency room can be very costly, and hospital stays in particular can be even more costly. The one thing that I would like to encourage and remind you as a lupus warrior is although those things can be expensive, it's important that you do not hesitate to get the health care that you need when you need it, although it may be an added and unexpected expense. When we talk about medications, you think about the cost of a prescription medication, think about the cost of specialty treatments that you may receive, and any over-the-counter medications and supplemental therapies that you're on. All of these are additional expenses that contribute to the cost of living with lupus. And then you have to take into consideration how is it impacting your education or your attendance at school? How is it impacting your workday? So your chronic disease, it doesn't discriminate. It doesn't say it's Monday through Friday. We can't act up today. We can't have a flare today. It doesn't discriminate at any point in time. You have a special meeting that you need to be in attendance to. Flare, don't act up. We know that lupus doesn't work like that. And so we know that it has an impact on your finances, it has an impact on your employment or your ability to be employed. And in addition, there's some other indirect costs of living with lupus that we don't talk about, and often we don't even discuss unrealized opportunities and potentials that are denied because of your lupus, whether it's because of a flare, because of you're not being able to get the education that you need to recognize that opportunity or to work on that opportunity, or whether it is just the fact that you're not even able to get up and go as you need to in order to pursue that opportunity. So, how can I make the best, or how can you make the best of costs? So let's talk about best practices in how you can manage your lupus and manage the burden and costs that lupus may bring to you. We know that communication is key. If you've ever heard me speak about lupus and the impact of lupus in your team, communicating with your healthcare team is key. You want to talk to your healthcare provider about your financial situation. You want to talk to them about your health insurance and your health insurance coverage. And most offices usually initiate that conversation even before you get to the office in regards to what insurance coverage do you have. But your ability also to cover recommended medications that your physician is recommending for you, any lab work or testing that needs to be run, and any planned and unplanned hospital visits. All of these things are things that I don't want you to be shy about talking to your healthcare provider about, or even being embarrassed about discussing your concerns about the financial impact that it may be having on you. You also want to be able to talk to your pharmacist. And you want to become familiar with a particular pharmacist and be able to have a discussion about what burden it may have on you. So we talked about talking with your physician, because know that your physician is your main partner in communicating the burden that lupus is having on you and how you can help lessen that burden, or your physician can help you lessen it by looking at all treatment options. We know we want the best for you and the best outcomes, but there may be some alternative treatments that hasn't been discussed. Also knowing who is the billing specialist in your doctor's office, who is the billing specialist in the clinic that you attend, who is the billing specialist at the hospital. Get to know those individuals on a first name basis, and know when you have to call and talk to someone, you want to talk to Sarah or Susan or Elizabeth, whoever it is that you have established that relationship with, and talk to them on a regular basis so you have that bond. You also want to speak to the benefits representative, because the benefits representative may be able to help tell you additional supports that are available out there to you. You want to be able to talk to your patient support coordinator. That is another person that's able to help put you in contact with resources that are available and other ways that you may be able to manage or lower the cost of managing your care. And of course, the biologic coordinator also. And I've already talked about the pharmacist. Being open with your healthcare provider and making sure that they are aware of what your financial stresses are, your financial needs, your financial support options, and what is key, and what do you want for your key outcome with your care. So we want to talk about what are some of the questions that you want to ask. Consider starting the conversation with your healthcare provider and your support staff with a few questions like, will this be covered? Will this medication be covered? Will this particular treatment be covered? Is it covered by your health insurance? Your physician may or may not have the immediate answer to that question, but as I said just on the slide before him, he can refer you to the billing specialist. He can refer you to a patient support coordinator or a biologic support coordinator that can help you get the answers and support and help to identify whether you have coverage for the treatment plan that he is recommending. Some medications and treatments require prior authorization. So you want to ask that question. Does this medication or treatment you're having require prior authorization from my insurance company? And you want to make sure that you get coverage and consent from that insurance company before you agree to that particular therapy. It's smart to better understand how much your insurance will cover and how the benefit will be paid before you agree to that treatment. Don't be embarrassed to ask the question also, do you offer a payment plan? Of course, some particular physician's office will request that you pay upfront or before your visit, but some will allow you to get on a payment plan. So don't be afraid to ask that question. Ask the question, is this medication being covered? This is a part of you being able to help manage your care. Okay, and is there a more affordable option is a very good question for you to remember to ask also. So when we talk about affordable option, a lot of times physicians will prescribe what the newest branded medication is, and sometimes you might need to see if there's other treatment options. So I want to remind you that you are your best advocate. You want to get comfortable with asking the difficult questions. In fact, you should view it as your job to ask questions and for you to expect to get the answers in detail, where you clearly understand what the answers are and what your treatment options are. So don't hesitate to speak up on your behalf and to understand what your coverage is, to understand what your treatment options are, and understand what it's going to cost you. It's also important for you to understand your insurance. You want to ask for a summary of benefits and coverage that has detailed information about your benefits and limitations or expectations. This may also be referred to as an explanation of your benefits. And with your insurance plan, there's always someone available that can explain to you what are your plan coverage and how will your coverage be paid out. Understanding your insurance coverage can help you avoid unexpected expenses and helps you to advocate for yourself. You want to also understand your plan's formulary. Drug coverage or insurance plans has a list of standard prescription medications that are covered. This is referred to as your formulary, as I just said. The formulary is usually broken down into tiers. Tiers are different prices for different medications, and the coverage for those tiers vary according to the plan. Those tiers come in as tier 1. Tier 1 includes medications with the lowest copays and often generic versions of the medication. If your physician prescribes to you a tier 2 includes medium cost medications with copay drugs and may include some generic medications. And when you think about, these are less experienced. You also have tier 3, which includes the highest copay drugs and includes branded drugs that are out there that maybe do not have a generic version. And then you have tier 4. Tier 4 formulary or tier 4 medications are considered to be the specialty medications for serious illnesses. If your physician recommends a medication that isn't covered on your insurance formulary, you may request that be added to your insurance plan. That takes you writing or having a document, submitting a written documentation to your insurance company that your physician would submit for a formulary exception. It's called a formulary exception. And this process can also enable you to obtain a medication that's on a higher and more expensive tier than the lower tier that you may be accustomed to paying for. So as you begin a new prescription, make sure that you understand what tier that medication is. You want to talk to your physician and understand what the out-of-cost price may possibly be for you. And then in addition, get the details about any specialty medication your physician may be prescribing for you, like whether it's an injection or an infusion. And it may be helpful also to speak with your insurance provider about scheduling and a payment plan for those medications as far as your out-of-pocket expense. So all of these are so very important for you to talk with your physician about. You have to look at, too, with your insurance plan, medical benefits versus your pharmacy benefits. So what's a medical benefit? If your medication is given in your physician's office, that's called a medical benefit. Your medical benefit is considered an in-office medical treatment or medical benefit. You're most likely to pay your regular copay for an office visit when you're receiving medications or treatments in the office under your medical benefits. If you have a pharmacy benefit, your insurance plan classifies the medication as a pharmacy benefit. Your cost may depend on the tier in which it falls on. You want to make sure that you self-advocate for yourself and know what tier it's going to be on and what cost it will be to you. In my final slide here, I'm going to talk to you about available resources. Healthcare.gov. If you're able to choose your health plan, you want to study up. Go to healthcare.com. This is where resources on healthcare plans can help you understand your options and make the most out of informed choices to avoid being underinsured. Know your insurance coverage. Remember, you can ask for explanations and clarification on your insurance plan. It's good for you to know a person to ask for when you call your benefits coordinator. There's a 1-800 number for most insurance plans that you need to be familiar with so you can get in touch with someone that can answer any questions that you may have. From there, you can find any documents that you need, a summary of your benefits. Someone can explain to you about that, what coverage you have, what tier your medications that your physician is prescribing to you on. You can get all of that detailed information from your insurance company. Know also that there is help from you from pharmaceutical companies. There are gateways and plans that are available that helps give you discounts, that helps with your copay, or helps with you managing where you may even have no out-of-pocket experience. And remember also, there are websites out there like GoodRx that helps give you discounted prices on your, and then if you look at More Than Lupus, if you go to the webpage More Than Lupus, they have many resources there. Kelly is a wealth of resources that is available to you. So make sure that you tap into the More Than Lupus webpage to find out what resources are available to you there. Remember you must speak up and be proactive. It's your health, it's your life, it's your responsibility for you to advocate for yourself. And with that, I would like to say thank you. I appreciate you allowing me to speak. And I have one other slide that I would like for all of you guys to get out your phones and use your QR code. I have a QR code that I would like to share with you that allows you to, if I can get to it quickly here, have a resource that's available to you. Ooh, I may not be able to get to it quickly. Just a moment here. I don't think I can. So I'm going to hold right there and kick it back to you, Kelly.
Thank you so much, Aliciee.
That was I'm sorry.
No problem. That was very valuable information. The only thing I would add about advocacy, having had lupus, there have been times when I've been in a flare in which I couldn't advocate for myself. So don't hesitate to take someone to your appointment, because sometimes you're just in tears and can't even articulate what you're feeling. Yes. So good information, Aliciee. We'll go back to Dr. Noble.
Hey, everybody. Sorry about the technical difficulties earlier, but just to recap, so heart disease is the #1 killer of Americans. Black and Latino patients suffer more significantly due to heart disease. And as we learned about lupus, lupus affects African Americans and Hispanics, and oftentimes can affect them at earlier ages. What that means, so studies have shown that in looking at the arteries of Black and Hispanic patients, they found calcium deposits were built up in their arteries, even though they did not have symptoms at earlier ages than their white counterparts. So what does that mean in context of heart disease being the #1 killer? So if this starts to develop at earlier ages, you can expect that lupus patients may die at earlier ages due to heart disease, and with oftentimes heart disease being a silent killer, and often women having symptoms of heart attacks that don't mirror themselves as the typical chest pain right in the middle of their chest. Women oftentimes go undiagnosed or diagnosed later of having severe heart disease, severe heart attacks, and oftentimes, as we're hearing, going undiagnosed or misdiagnosed as having lupus. One of the complications that we alluded to earlier as far as lupus and heart disease is pericarditis, or inflammation around the heart. Fortunately, for those 25% of patients that develop that inflammation, it is treated usually non-operatively, anti-inflammatory medications. But the moral of the story is that heart disease and lupus go hand in hand. That brings us to something that Aliciee just talked about. What can be done about it? First and foremost, there are community organizations out there that are really looking to address some of the disparities that have been touched on today, especially by Ebony, and that is healthcare access. If you don't have health insurance, it's very difficult to access healthcare within the United States. Fortunately, there are organizations like Health in Her Hue, and also other organizations like LiveShare Health, which is a healthcare organization looking to connect people of color with healthcare resources and access in a physician, really trying to build that trust, that partnership that Aliciee talked to about being able to have that dialogue. What we try to do at LiveShare Health is try to mirror that same relationship with your barber, your stylist, or your pastor, and try to have that relationship or something similar to it with your primary care provider. What ends up happening, individuals come to us, and first we try to see, do they have access to healthcare? Because without access to healthcare, some of the things that we're talking about just can't happen. Getting medical coverage, getting pharmaceutical benefits, and even participating in clinical trials. So one of the reasons as to why you don't see some of us participating in clinical trials is because A, we don't have health insurance, or B, if we do have health insurance, we may have coverage that doesn't allow us to participate in clinical trials if certain states don't allow Medicaid participants to participate in clinical trials. So what we do at LiveShare Health is try to help people, A, get access, B, find a primary care provider that they can develop that relationship with. Because oftentimes with some of these health insurance companies or these MCOs, you get assigned to a primary care provider. You don't have that same sort of relationship. Some of us don't get assigned to our hairstylist. We go out and pick and choose that person. So you would want to pick and choose that person that's going to walk that journey with you of getting you better and proper health. So with LiveShare Health, we really try to do our best to connect individuals with healthcare resources, information, and education that they can use. So there's community programs that are out there and community organizations, but what can you do if you have lupus or if someone that you know has lupus? Well, the first thing I recommend to everybody is exercise. Because the heart is a muscle, it's very important to work that muscle out. Exercising 30 minutes a day, 3 to 5 times a week is very important. God has created a great ability for the heart to create new routes of blood flow if there are blockages in particular arteries. That comes about by exercising. So it's very important to exercise and really to try to get your heart rate up. Doing things as simple as push-ups within your house can be an exercise that you can do to really work yourself and kind of get a good workout. Studies have shown it for men, if they can do 40 push-ups within a minute, it correlates with a lower risk of having a heart attack. So exercise is very key. Second is nutrition. I'm not one that really tells my patients to go on a prescriptive diet, but if there is one diet that I would recommend for lupus patients, even though studies have shown that there's no one sort of diet that can prevent flares or anything of that nature, I would recommend a heart healthy diet. Why? Because we know that heart disease is the #1 killer of Americans, and lupus patients are prone to develop heart disease. With that being said, having participating in a heart healthy diet is very important. What does that mean? For me, it just means eat a diet that is very colorful. You want to eat fresh fruits and vegetables, green leafy vegetables, as well as you want to eat lean meats. Try to stay away from the heavily processed foods, those foods that are known to be pro-inflammatory. So what we know in cardiac disease or heart disease is that diets that have that are pro-inflammatory or cause a lot of inflammation can lead to atrial fibrillation or an irregular heartbeat. What are some of those pro-inflammatory foods? Well, some of the foods that we like, here in America, white bread, fried foods, a lot of foods that may taste good, but are very bad for the heart and are very pro-inflammatory. And so the third thing that I recommend for patients with lupus is to know yourself, really kind of get in tune with yourself so that you kind of know what good days and bad days are. Oftentimes in medicine, we ask patients about their pain, and we ask on a pain score of 0 to 10. I recommend that for patients, on a day-to-day basis, kind of gauge yourself as to how today was. Was today a day in which you felt great, or a 10, or was today a day in which you didn't feel too great and it was about a 1 or a 3? You want to have some sort of idea of being able to articulate how you feel so that you can help your provider with the symptoms that you may have. And as the fourth thing, as Aliciee stated, is advocate for yourself. As a provider, that relationship that I have with my patients is one that I cherish. But I know that not every patient has a great relationship with their provider. It's important to be able to advocate for yourself. I too recommend for my patients to bring a family member with them. Studies have shown that when patients get communicated bad news, they can only retain about 50% of that information at that visit. So it's very important to bring someone with you to help take in that information and to ask questions. Again, write questions down so that when you show up to the doctor's office, you have your questions prepared and you can answer them. And in regards to advocating for yourself, just like if you get a bad haircut or you don't like your hairstylist, or you just feel like the hairstylist isn't doing right by you, you change your hairstylist. It's the same thing with your provider. Don't feel ashamed or don't feel intimidated by saying, you know what, I need a new provider. And, for better or for worse, I've had patients come to me because they end up switching provider or they didn't like, the provider that they were with before. So in recap, lupus affects Black Americans and Hispanics. It affects the heart. 25% of patients develop pericarditis or inflammation around the heart. Additionally, it can affect the heart and lead to early stage heart disease. For individuals to really advocate for themselves, it's important to know your body, be willing to switch providers if necessary, take someone with you to your doctor's appointment, and always eat a heart healthy diet, stuff that is very colorful. You want to eat the rainbow, red berries, strawberries, blueberries, things of that nature. And make sure that you check out other resources as far as Live Chair Health, organizations like Health in Her Hue, which is designed in a platform created for Black women to find other Black female providers so that they can have that relationship that was alluded to earlier. By doing this, I think that individuals can get a better handle, or as best a handle as possible, with lupus, because this is a journey and it's a struggle, and it's something that will be with you for the rest of your life. So thank you.
Thank you, son. Since you referred to me as mom, that was good information. And again, we appreciate all three of you, and that was, like I said, invaluable information, and we thank you. At this time, our founder of More Than Lupus, Kelly, will join us. Hi, Kelly.
Hi there. Wow, that was a lot of fantastic and helpful information and some very valuable resources. And for some of the websites and slides that were presented today, we will have that information available to you if you didn't catch the websites that were going up on the interactive screen. I also just want to mention briefly that the opinions shared today are purely for informational purposes and do not replace the advice of your opinion of your doctor or your medical professional. And if you are experiencing lupus or lupus overlap symptoms, it's really important to speak to your doctor and seek treatment that is right for you. These are all qualified professionals, and their comments are based on years of experience in their field. However, they're not liable or acting as your personal physician. So I just wanted to make sure everyone watching this now or streaming this later was aware of that information. We do have a lot of comments that have come in. If we maybe spend a couple more minutes before we log off going through those. we had a lot of thank yous, a lot of people who are just thrilled with the information shared today, people joining from all over the U.S., from the East Coast to Chicago to California. We have, it looks like a relative, Jay, is here attending. Jay Noble's here. Says, glad to be attending and look forward to soaking up as much knowledge as possible concerning lupus and the community. We have Lupus Forum sharing this everywhere. Looms for Lupus is on with us. We have Lupus Spoons on with us. We have Tia joining as she says good afternoon. We have Naomi from Washington, D.C. saying thank you for this event. Okay, here's an interesting comment. Here's a professor, Linda, and I hope I am understanding this comment, and it's an appropriate question to ask. I'm a professor who teaches immunology and who does lupus research. Are health disparities in lupus more responsible for the development and severity of lupus than genetics? That's an interesting question. Not sure who would like to address that one. Just giving as a broad question.
Repeat the question. So are health disparities more important than the genetics of disease?
More responsible for the development and severity of lupus than genetics.
So I think the way to maybe address this is that health disparities are not. So I will say that genetics and social determinants of health, they both are significant factors that contribute to health disparities within lupus. But I think that's the way to frame it. I don't think I'm understanding. The way to frame it is that both are factors in the progression of lupus and the severity of it.
Yeah. And I would include environmental factors can be a contributing factor to being diagnosed with lupus too. So I was trying to look at the question.
Well, that brings up a good point about environmental. As most of you know, it takes years to get that diagnosis of lupus. You know, some people go anywhere from 5 years to longer. They know something's not right, but it takes a while to get that, confirmation. And when I was first trying to figure out what was going on with me, I was asked more than 2 times, did you grow up near a power plant? Did you grow up near this? Did you grow up near? So yeah, environmental. Yeah.
Thank you for your question. We're going to move on for time's sake. We have lots of people thanking you for your time today. Let's see here. Great information, great information. Thank you for providing the resources, Dr. Steve. Awesome information. This was really good. So I think that was all of the questions. A lot of just really positive affirmations. Okay, this is a follow-up to that question. When I teach about lupus to medical students, they feel stigmatized about lecturing to students of color and telling them that lupus is more common among people of color. That was the follow-up to that. So she's wondering if, I think it's more about being stigmatized as a disease of people of color. Is that what she's saying? Interesting. Can you see that?
Yeah, I do. I agree with you, Kelly. I think that's kind of what she's speaking to.
Okay.
I would just say, as it is now, the facts are the facts. Lupus happens 3 to 4 times greater in people of color, and unfortunately, that's just the facts of what it is now.
Exactly.
And I also think it's the way, I think it's in medical schools, you have to speak of really learn interpersonal skills and how you frame certain things. So it has to be, fellows or medical practitioners being comfortable with speaking about these facts with members, not necessarily of their direct community. And it's all about how we frame and really engage in the conversation and being genuine. As Alice said, the facts are the facts, and lupus does affect people of color more, but it really is how you are engaging in a meaningful dialogue with the patients and with, the community at large.
And the thing I'd like to add is that, as Aliciee has perfectly said, education is emancipation. So having that knowledge, having that education should empower individuals that there are certain things that they need to look out for later on in life. So if I'm more prone to develop lupus and I'm more prone to develop heart disease, I need to really advocate for myself. If I feel a little twinge that doesn't feel quite right, sometimes fatigue, shortness of breath could be a sign of a heart attack in a woman. And if you have lupus, those things can really be detrimental. So I think it's, again, the facts are the facts, and having that education is emancipation to have the life that we all want to have for ourselves.
Well said. Well said, all of you. Facts are the facts. I think that's about it. We had a comment from Lumens for Lupus. I would agree with you all. We need to ensure we frame and are engaging. Great advice. On that note, it's 2:07. Want to be respectful of everyone's time. Thank you again for sharing your time with us and your expertise with us. We look forward to continuing this plan of action with our next 2 installments in the Lupus and Minority series. Our next will be how lupus affects Asian American and AAPI populations, and that will be in April. Thank you again. This will be available to you in a few days via YouTube. If you know someone who would like to view this presentation who maybe does not have Facebook or some of the other social media outlets. I'm going to just hand it over to Anita briefly to close us out.
Well, that information, I'm sure everyone who was watching today found something that was really applicable to them. And so for that, I thank our 3 presenters for knowing the exact items they need to touch on. I see Naomi has just popped up from Washington, D.C. And, this is what's so great about More Than Lupus. We have a wonderful circle around the world, and we just can't thank the 3 of you enough for helping us wrap up Black History Month with how lupus affects people of color. Again, thank you so much for your time.
Thank you. We'll see you next time.
All right. Bye-bye.